Hello, everyone. Welcome to Ask the Mentor. I'm Dr. Russo, and I am here for you. Going to talk about some interesting stuff tonight, but I just wanted to do a little housekeeping first. Hey, Carmel, you're the first one on. You're going to definitely get a wave. Tell us where you guys are from. It's always interesting to hear people coming from distances to listen to us, and it's always fun to see people from all different walks of life. And let us know what you do. Are you a doc, a nurse, an NP, MD, LPN, PN, RN, MD, whatever? We've been getting a lot of questions about, hey, Dr. Russo, can you mentor me? Hey, Dr. Russo, how do I train with you? If you just go to the link in our bio right here on Instagram, you'll see it'll open up and it'll show you the different campuses we have, the different courses we have. It'll show you why we're the best in the business. And it'll show you why we are so important and vital in this industry, because really our goal is to raise the level of medical aesthetic education, because I think you'll see in a lot of different places it isn't great. We want to be great. We are great. We want to share that with you. So let's talk about event planning, right? Has anyone here ever... hello, RN at Deluxe Bar. One of our favorite groups. North Branford, Connecticut. My brother married a girl from North Branford, Connecticut. You may know them. So, has any one of you ever sort of had a patient come in and said, hey, I want to get treated for Thanksgiving, or you were just watching the videos on our website? I hope you enjoy them. There's a bunch of material. I can pretty much talk forever, but so someone comes in and wants to be treated for Thanksgiving, Christmas, Hanukkah, Kwanzaa, whatever the event may be, and they end up getting a bruise, a ptosis, an occlusion, swelling, and it makes them crazy, and it makes you crazy, and it just ruins everything. So I'm sure this has happened. Hi, attending Neurotoxins 2 on Monday. That's a great course. I think you'll really enjoy it. I had a lot of fun putting that together, and I think the teaching is excellent, and congratulations on making it to that level. Keep going. Southington, Connecticut. I'm from Connecticut, my old stomping grounds. Good to see you guys. So, that's one of the toughest things is learning when not to treat somebody, right? Because, people are going to come in and put pressure on you. Hey, it's only a week before Thanksgiving, and I'm sure nothing's going to happen. I have this 58 people coming over, but I know you're good, and I know you're okay, and you've done this before, and that's the time that you're going to get trapped, right? That's the time that it happens. It's happened to me. It happened to me, a number of years ago when one of my patients, a really good patient, her husband was a dentist, and she came from a family of doctors and dentists, and I don't know, and her son was getting married. He was a doctor. His fiance, soon-to-be wife, was a doctor. They came from a family of doctors, and I gave her one of the worst eyelid ptoses I've given anybody. Probably the 8th time I treated her. So what happened the other 7 times and what happened on the 8th time, no one really knows. But the point is that you never really know, no matter who you are, how good you are, how many you've done. It's a numbers game, and eventually something will happen. So we've got to think about how we talk to patients, treat their levels of expectations. I'm going to Neurotoxin 2 on Monday also, and Lips on Tuesday. You're in it to win it. Charles and Maverick, happy birthday, Maverick. He's 2 years old today, my prized little puppy boy. The best guy ever. So, when people put pressure on you, at least this is how I feel. I feel like if I'm really worried about making a mistake, I make a mistake. Like if I'm really trying my best not to do it, I do it. It's that extra pressure that just sort of changes something that you do, right? It's like if you're treating a doctor's wife, or your wife, or somebody else's wife, or whatever it is, a really important CEO, or someone, a famous movie star. You always do something a little different. That's why doctors' wives are always the worst patients, because you're trying to do a little extra, and you do something different than you ordinarily do it, and it messes up most times, right? So it's terrible. So come to grips with the fact that, if someone's asking you to get off your game and just do this for them because it's going to help them, it may just backfire on you. So think about it this way. As a provider, right, patients are coming to us for help. We want to guide them through this process. We want to give them realistic expectations as to what we can do. We also want to give them, the best results we can, but we really have to be honest with them. So if someone comes in and is like, I know I should have been here earlier, but my daughter's getting married, I've been so busy, and the wedding's next week, can you please do all this stuff? And I would just say, honestly, no. I just wouldn't, because I don't want to be the one responsible for whatever potential complication you have. And that's the time it's going to happen. So, there are some things we can do, and I'll get to that at the end of the talk. Tell me where you guys are from. Tell me if you're from anywhere other than just around here by me in Boston, because it's always interesting to see where people are listening from. So that's the time where you got to be really careful and be honest. You know what? I don't want to put you in a position where you're going to get a hematoma or a bruise or an occlusion or a ptosis or whatever that, even just some swelling and some unevenness or asymmetry. So let's talk about the reality of what we can do today that isn't going to do anything negative to you and is going to reduce the chance of that happening. So let's start maybe with fillers and timelines, right? So timelines are important because people don't always think about the treatment today, but they don't think about the timeline of what happens to that product over time. We don't want the patient's event, whether it's Thanksgiving or birthday or holiday or whatever it is, to coincide and collide with our recovery period or our downtime, right? Because we don't want to ruin that event for that patient. So we have to think carefully about it. So the general principles of injectables, right, is when we treat someone with injectables, we are sticking a needle underneath the skin. We can't see under the skin where there's, bazillions of blood vessels. So the chances of bruising someone and causing a hematoma or just a bruise or some swelling is pretty high, right? Pretty high, particularly when the patient's all revved up and their blood pressure and heart rate's up and your blood pressure and your heart rate's up because you don't want to, make a mistake. And it happens, right? But in addition to that, when we do inject a gel, when we do inject whatever, let's say HA gel we're using, those are all hydrophilic gels, right? Those gels all take on water. So when we inject it into somebody, they might look perfectly fine when we do it, but over the course of the next couple weeks, as that product gets into equilibrium with the tissue and it takes on water, we might find that if we use a particular hydrophilic product, we got too much of a tissue response. We've sort of overdone it, and then you're 2 weeks into it, and maybe that's when the person's event was, and they look kind of not so great, and they're really upset, and the pictures don't look good, and so we have to think, okay, so if we're doing these injections, the short-term immediate consequences of hematoma, swelling, bruising, occlusions, and that whole little dance people do, and then the longer-term treatment of the product going into equilibrium with the tissue. Personally, I think that even High Sky Skin Center, that must be Hitai, our favorite, even when done in the best hands, I personally think it takes 3 to 4 weeks after an injection to see the product get into equilibrium with the tissues and for it to look its best. Because I think in that early phase, there's some edema, there's some puffiness, there may be some bruising, some swelling, there's definitely palpability, sometimes visibility. So, I think if someone's looking for fillers, I would be sure that there's at least a 3-week window before their event. If they come in a week or so before, I would just say, no, the risks are just too high and I don't want to ruin this event for you. I don't want to create this potential problem for you. And that's hard to do sometimes. It's hard to say no to patients. I mean, we're all here to help patients and make them feel and look better. But when presented with that, risk-reward ratio, it's not a good one. Like I said, it's happened to me, and I've been seeing a patient this past week from New Hampshire who was treated just before Thanksgiving, and she ended up with this horrific response in her cheeks. They swelled up, and she was having terrible pain, and she came in, and I dissolved it for them. I sent her back, and now she's got abscesses in her face and draining pus, and I was just like, oh my God, this poor woman. But, be smart about it. This was this patient's first treatment, and she got kind of over-treated, and it's a disaster, right? So we all could go down that road, but my goal is to sort of make you safe injectors and be honest and safe and caring about people. Not that you already aren't. But hydrophilic nature of the product is important. The viscosity and the G' of the product are important because if it's someone with thin skin and you put a high G' product in there, you might have visibility and palpability. And so we have to give ourselves enough time for those products to work. Neurotoxins are a little bit different. There are far, far, far more adverse events with neurotoxins than there are with fillers. primarily because I don't think people really understand neurotoxin anatomy. I don't think people understand how the muscles work, how deep they are, which ones are next to each other, which ones are on top of the others, which ones are on the bottom. So I think we see neurotoxin problems all the time. I think the forehead, number one, people still don't understand the forehead, even if they've been treating for a while. And the other areas, the jaw, the mouth, the chin, people don't understand which muscles are where. So it's common for me to see lip problems, eye problems, brow problems. And, and it's just a lack of understanding and a lack of anatomy. So if someone comes in, hey, Kate, good to see you. Loyal customer, comes every week. Good to see you. One of our best NPs. Ready for you to break away on your own. I'm really excited for that someday. So think about neurotoxin. If you inject someone with neurotoxin, you know that it doesn't really take effect at all, doesn't really start working for a couple of days, and it really takes about 14 days, I tell patients, before it reaches its peak. So at the 14th day, if they're not happy and they need to come in for a touch-up, you're talking again about a 3-week window, right? Because you don't want to give someone a Spock eye or brow ptosis or lid ptosis or some asymmetry, and then at 2 weeks, try to fix it when their event is like, they came in 3 or 4 weeks before the event. Now you've got a real problem on your hands, right? So I think you got to give yourself a month, before giving someone neurotoxin for a big event. Because, God forbid something should happen, you don't really have time to fix it. You really won't necessarily see the whole thing until 2 weeks out. So you've got a little bit of time to correct it. But you can correct most of these things. You really can. Even an eyelid ptosis. Probably the one thing you can't really correct is a brow ptosis, or you really, it's kind of hard to equalize that. So think smart about that, and let the patients know, maybe even do a lesser treatment, or maybe don't do the areas where you're likely to get a ptosis, because again, no treatment is better than treating someone for a big event and having a bad outcome, right? So I would just tell the patient, if you can't get here a month before your event, then I'm just not going to treat you. I don't want to take that risk for you. I don't want to be the one who's on the other end of that syringe and makes you unhappy. So think about that. Just remember how the product works and where it peaks and what it works with. But there are also some non-invasive. If you guys have any questions, please ask me now. And Maddie's sitting next to me. She'll write them down, and I will answer them. I'll do my best to answer them. Is anybody from far away? Is anyone listening to me from anywhere outside of Massachusetts? It's always interesting to hear where people are calling from. And by the way, as I mentioned earlier, we're getting a lot of requests for me to help or mentor people or to train with us. And just go to the link in our bio, and you'll see all the information of where our schools are located, what our course curriculum looks like, where we're, when each course is being offered, and how often, and sign up and come. I mean, I'd love to meet you. I'd love to teach you. I'd love to elevate. Hey, Norway. It must be really late in Norway. It must be like the middle of the night for you guys. Well, thanks. I appreciate you tuning in. You probably have the same problems we have here in America. It's kind of a universal truth, I think. But, there are things you can do for patients if they come in on a short term. Some people say, I wish I'd gotten here earlier. It's a week before my daughter's wedding. What can you do for me? Well, we can do things like hydrofacials, dermaglows, diamond glows, aqua gold treatment, Softwave, Ulthera, topical RF, maybe microneedling with RF. Things that are going to give them some bang for their buck. They're going to get some improvement. Their makeup will look better. Their skin will look smoother. I mean, you're not going to, change them overnight, but at least they're going to feel better. They're going to look better, and you've done something. And don't forget those in-between things. If neurotoxins and fillers are like the longest delay, and you've got the things that you could do immediately, in between you have things like peels, laser treatments, microneedling with RF, different kind of treatments where you're using energy-based treatments. And with peels, you're looking at minimum of a week. Sometimes I would give myself probably 2 weeks. If someone wants to get a peel with laser, it really depends on what you're doing. But obviously, the risk with lasers is sort of protracted erythema, and burn. So that can certainly happen. So with a laser, I probably would avoid that unless I had at least a month before whatever treatment it was, particularly if it's on the face, which is really what we're talking about today. If you burn someone's leg during a laser hair removal, it's probably not a big deal unless you're going to wear a dress and it's summertime, and you probably wouldn't be doing laser in the summertime anyway. But nevertheless, be careful and thoughtful about it. And even sometimes microneedling or some of these minor treatments, You can get allergic reactions. You can get problems happening. So never do anything that takes less than a week, right, to recover from, or that takes more than a week to recover from. So with respect to some of these other treatments, the topical treatments, I mean, you just have to explain to the patient, none of this is going to be amazing. None of this is going to change your life, but we certainly can do things that will make you look better short term. And next time, come in, a month or two before. There's so many stories that I've seen in my own practice, and I'm always the one that has a hard time saying no to patients, because it's like, I know I can do this, I know I can make it better, I know I can, but you don't always know you can. And it's that one time that it doesn't go well. And I've seen people from other docs and nurses who they were getting married, they were the bride or the groom, really mostly the bride, and I saw a really bad eyelid ptosis, I saw really bad brow ptosis, and I did my best to help them. I saw another woman who had her son's wedding in California, in a very wealthy family, and the whole big thing, and she got her first injection ever of filler, and she got necrosis of like the whole corner of her mouth like this. The person came in this way, and I think hit the bifurcation where the facial vein were bifurcating, and didn't notice anything right away. The patient went home, spent the whole weekend at home, never called the provider, and she came in and this whole area was black. And I think she had a big hematoma that by pressure just sort of caused an occlusion and venous outflow obstruction. And we worked on her for, a month straight. And a month before the wedding, she just broke down crying. She had a big black eschar in the corner of her mouth. And she was just crying. She was so distraught, And I debrided it. I actually took the eschar off, the black dead eschar. And she had some nice pink tissue underneath it. And I was treating her with PRP and giving her every skincare product I had and every vitamin. Again, I didn't treat this patient, but I took care of this patient. And that was about a week before the wedding, it just seemed hopeless. And, all of a sudden, she really started healing. She flew out to California. They had a professional makeup crew waiting for her. They fixed her up and made her look pretty presentable. And, it worked out okay. I worked on that patient for over 2 years, never charged her a dime, operated on her 3 or 4 times. The nurse that was involved with the case, was there all the time, drove the patient to the appointments with her, held her hand through the appointments, was really quite good. And, she ended up with a little bit of functional problems in terms of drinking and stuff, because she did lose a fair amount of tissue and the lip and the orbicularis muscle. But, this was someone trying to do something good. And, that's the one time where it is very sad. It was terribly sad. It was terribly sad. In all my years, we've probably seen 50 occlusions, I would say. Hello, Emily. That's my daughter. Hey, Emily. Good to see you. Thank you for joining in. We're talking about some sad stuff. I probably have seen about 50 occlusions over the years, and I've seen two that were resulted in permanent loss. The other, 48 or so, all recovered. They were all HA fillers, recovered well, with no long-term sequelae, and but they were all treated early and aggressively. These two that I'm talking about were both like their first time, and one of them went to a good provider, one of them went to a really bad provider. And the one other patient I'm talking about, she was an attorney, like for the IRS or something, or for the FBI, for something like that. And her husband was an ER doctor, and she was treated again before an event in her lip, and she noticed that this whole area turned white right away, and she was in incredible pain. And the nurse that treated her just said, it's okay, just take some Tylenol and massage the area. The patient got no sleep that night. He was crying in pain. Went back to the nurse, said, you've got to do something. And the nurse, said, well, you should go see Dr. Russo then. And her, she came in and her lip was as white can be. Pain, couldn't even touch it. And so within just a few minutes, I gave her some hyaluronidase, and within, I don't know, 2 or 3 minutes, you could start to see the faintest little bit of pink, and she's like, oh my God, I'm starting to feel better. And unfortunately, it was more than 48 hours later, and she ended up with some necrosis here. And I worked on her for probably 2 years also. Never charged her a cent because I just felt so bad for her. Now, believe it or not, neither one of these patients sued their provider. Neither one. And you've got patients suing people for scratches or for brow ptosis, but these 2 people didn't, and I'm not really sure why. But this one patient taught me something really interesting. She said, that provider, her confidence was much greater than her competence, right? And she said, if I had come to see you sooner, is it true that I would have been okay and I wouldn't have lost the tissue? I said, I wasn't there and I didn't see exactly what happened, but certainly in any kind of situation like this, when you have, a problem with blood flow, the sooner you treat it, the sooner you fix the problem, the better. So probably, I had to be honest about it. I'm not going to lie to this poor woman. And she just was like, why did she do that? I said, I don't know. Maybe she was just lacking confidence. Maybe she was afraid that she was going to get in trouble. I don't know. I don't know what makes people do things that they do. But, at the end of that 2-year period, and then, again, this was her first exposure to fillers. She, you probably, if I didn't tell you anything was wrong or had happened to her, you might say, her lip looks a little funny, but you probably wouldn't really notice. And she had no functional deficit, but certainly it didn't look perfect. But we did all we could do after 2 years. So those are the kind of things that can happen. So I'm giving you extreme examples, but the point is I just want you to think about your patients when they come in and, they have a big event coming up. Sometimes just not treating patients is the best thing to do, and just being perfectly honest and saying, I don't want to be the person that ruins your daughter's wedding or whatever your event is because you've got a complication, and it can happen to anybody because you can't see under the skin and things happen, right? And when you put that kind of pressure on providers, sometimes bad things happen. So that's all I had to say. Are there any questions we want? No. So those were my words of wisdom tonight. Hope you all had a great holiday. And remember, all your patients coming in now are going to be thinking about the holiday. So just make sure you ask them, do you have any big events coming up before I stick this big needle in your face? Because I don't want to cause any problems. I will treat Kate before her wedding because I know she's going to give me a lot of notice. And congratulations. I can't wait. You're going to invite us, right? Hopefully. We'd love to be there. I'm sure you're going to be a beautiful bride. So anyway, thank you guys. I'll see you next Tuesday, same time, same bat station. Have a great week and work off some of those Thanksgiving pounds. Bye. Good night. Low-key audience tonight. Usually we get a lot of questions.